There's a new pediatric clinic outside Montreal, and it could help ease the burden on the city's emergency rooms. The clinic is now open in St. Eustache, hopes to alleviate pressure on hospital emergency rooms while offering a glimpse into the future for emergency care here in Quebec. Parents will be able to book appointments for their child on Bonjour Santé for any emergency that doesn't require a 911, and appointments will be opening every 24 hours. Patients are then triaged and given immediate care instead of waiting hours, as they would most likely do in a hospital ER. And most patients are seen within 90 minutes. Let's go now to Dr. Sasha Dubrovski, president and co-founder of the UP Center for Pediatric Emergencies and Specialized Care, which opened a similar facility in Brossard in 2019. Dr. Dubrovski, welcome to the program.
Hey, thank you for having me, Elias.
Okay, so let's talk about the UP Center here that you're now opening in St. Eustache. You're the second type of this clinic. Tell our listeners a little bit more about this clinic.
So I'm a pediatric emergency doctor, and for a long time we were noticing patients coming from very far to come to Saint-Justine or the Montreal Children's to seek care for their kids, or ended up waiting in their regional emergency rooms amidst adults waiting for hours and hours and hours for care. And so in 2019, we thought, well, let's see if we could open a new model of care that kind of brings a high level of quality care into the community so that we could help parents close to home and maybe prevent them from having to cross bridges to go to the Children's or the Saint-Justine. So that's what we did in 2019 in Brossard, and the project proved to really help both regional and tertiary care hospitals. We're caring for, nearly 80,000 emergency visits per year at the site in Brossard, and we just opened in St. Eustache, trying to alleviate the North Shore's crunch for care, and we're hoping to start off the year with at least 40 to 50,000 visits seen outside of the city's hospitals.
And Dr. Dubrovski, pardon this question, I just feel like I have to ask it nowadays when it comes to Quebec healthcare. These clinics, these UP centers, they're part of the public system? Is this private? Do people have to pay? How does this work?
It works. It's essentially an extension of the regional hospital. It's all RAMQ.
Okay.
It's public care. And we're really aiming to be an integrated solution into the public healthcare system. So we partner with the regional authorities, the local CISs, and we become an extension of their hospital. So
they must be all on board with this as to try and alleviate pressures on other parts of the healthcare system. So I guess they're loving this as well as a way to alleviate pressure.
Absolutely. With any change, and especially when it's a new model, there's always a little bit of hesitance and caution that's taken to see how are we going to integrate, how will we impact change, what are the unforeseen side effects of implementing a new system. But the UP model is really to partner with the regional systems, both the hospitals, the family medicine clinics, the other specialized services in the region, and really serve as that in-between solution for things that normally head to the hospital, but probably can get seen outside of a hospital if you have the right technical plateau. Mm-hmm. By technical plateau, what I mean is having an integrated within the service offering outside of the hospital, access to X-rays in real time, access to blood tests in real time, access to pediatric nurses who can do intravenous and intramuscular, infusions and therapies, and really bring care to 2023 where a lot of care can get done close to home if you bring the right combination of team players and make sure you're integrated into the mission of the regional authorities.
With Dr. Sasha Dubrovski now, the president and co-founder of the UP Center for Pediatric Emergencies and Specialized Care. They've just opened up a second clinic in St. Eustache. So Dr. Dubrovski, why don't you take me through maybe a typical scenario? Every parent is going to be faced at one point, oh, my child is not feeling well, my child is sick, I need to get care, emergency care. Why don't you give me a typical scenario and how they would receive care at an UP center?
Got it. So I'm going to use two typical scenarios. So the first typical scenario is my child fell, has a broken arm, it looks deformed, he's in pain, I put on a slab, and I'm like, okay, where do I go now? Do I need to go to the hospital and wait and congest our city's hospitals? Or can I just show up at UP and get the care that my kid deserves? And it turns out that if you're on the North Shore or on the South Shore in those vicinities, you could just show up, and we have a solution where we could diagnose the fractures, mobilize the fractures. If they're bent out of shape, we could even put them back into place using a lot of child-free, pain-free strategies, and give them definitive care, all within about an hour and a half of the injury. On the flip side, if you have a kid who has a fever for 1 week, you're really worried it's not going away, and you're like, well, where can I get care for my kid? Can I go to the ideal is you go to your family doctor or nurse practitioner, but if they don't have slots for you, do you go to the hospital, or can you come to UP? So what UP is designed is you go to our website, you try to book an appointment on our website. The appointments kind of are dynamically opening every day, and allow parents to make real-time appointments. And so they would make an appointment, and then they would be able to come to their appointment, because kids with persistent fevers, for example, it's an urgent problem that may need care, but it may not need the immediacy of an ambulance-type care that a hospital is designed for. So waiting a few hours and balancing those patients over the course of the day is really what the magic of the UP system allows for parents to sit at home with their kid where they're comfortable and come in for their appointment at the scheduled time.
Dr. Dubrovski, you just brought me back to my earliest memory. My earliest memory in life is I was on my couch at home, and I was on the top part of the couch, just, playing games, and I rolled off the top of the couch and hit my head on a table and had to be rushed to Saint Justin, which is near where I grew up. And that's my first memory. And I just remember how, my mother was so concerned, and just, and you remember how parents can be so concerned when their kids have accidents. So it's interesting.
Absolutely. And, I'm a parent of 3 kids, and those of you who know my story know that I've lived all of the different accidents and medical problems, and even some more tertiary care problems. And as a parent, you just want to know where you have a quality place close to home that you can easily access. You don't need to be in fighter mode to get your kid the care they deserve. And so really UP is here to help both the regional hospitals, the tertiary care hospitals of the city, spread out the access to care in the right place at the right time by the right group of professionals.
How do you ensure that, your UP centers don't become too popular to the point where they face the same issues that the ERs have?
So the advantage that we have being not a hospital emergency room is we're open 12 hours a day, 7 days a week, 365 days a year. At the sites at South Shore, we are indeed pretty popular, which is great and inspiring at the same time, because we have 5-fold the demand for our services every day than what we can deliver. We're offering 200 to 250 slots a day at the South Shore, 100 to 150 on the North Shore. But the volumes of our website traffic is sometimes 5-fold that. So the advantage we have, though, is there is a certain number of spots per day that are open. And so when parents can't get an appointment, they will often seek alternate solutions. And some of those parents may end up going to the emergency rooms or their family doctors. That said, we continuously are paying attention on a day-to-day, if not even an hour-to-hour basis, to the demand for care, and we're working really, really hard to augment the number of slots per day that we can provide the community and really help our public healthcare system achieve the results that we've all, every doctor and nurse and healthcare provider and everywhere in Quebec are working so hard to be able to deliver the care that they've dreamt that they would be able to deliver. And we're just hoping to be part of the solution that helps get the right kids seen at the right time by the right professionals and keep our hospitals protected for those 911 type cases that really need complex care.
Dr. Dubrovski, thanks so much for taking the time. I'm on the website right now, by the way. centerup.ca is how you can find out more details. Really glad to hear about another option for people on the North Shore. Appreciate your time.
Thank you so much. Have a great day.
That is Dr. Sasha Dubrovski, president and co-founder of UP Center for Pediatric Emergencies and Specialized Care.